Hello, everyone. Welcome to the first ever Lilia AI webinar. And we are really excited to have everybody join and talk about a really cool topic in AI and healthcare, specifically AI and neurosurgery. And my name is Ali. I'm founder and CEO of Lilia AI. We have my co-founders, Adam and Abdul here, and we also have uh, awesome Texas A&M medical student who's been helping out with so many different things, Mariam. And also we have two great guests here to talk about our neurosurgery AI topic. Uh, First, we have medical student Kishore, who's a fourth year medical student at Texas A&M, currently doing a whole research fellowship year at the University of Oklahoma Department of Neurosurgery, doing some really cool cutting edge neurosurgical AI research in a variety of different topics. We also have our dear friend Romulo, who's a neurosurgeon trained in Brazil and currently doing research at the world-renowned MD Anderson Cancer Center in the Department of Neurosurgery with the world's leading brain and spine tumor neurosurgeons. Really excited to, learn more about the cutting edge in AI and neurosurgery, and I'll let Kishore and Romulo take it from here.
Sounds good. Hi, everyone. Ali, it's a great pleasure to be here. Honored to be here to be, kind of kicking off this series. I've seen you and your team put a lot of work behind the scenes, so it's kind of nice to see that all the planning, the strategy come to reality. And then, it's an honor to be a part of the first process. So thank you for having us. We're gonna, we're gonna talk a little bit about AI and machine learning, as you said. It's a pretty hot topic. Everyone is talking about it. It's a common term now in the households, and we kind of wanted to take everyone on a journey. So kind of building on what the fundamentals of AI and machine learning, just the basic definitions, and then building up to its role in medicine, and then eventually its role in neurosurgery. So we have a little bit of a journey, but it's going to be a fun one, and we're going to take you along every step of the way. So to begin, I think the first question obviously is what is AI and what is machine learning, right? And everyone has their own definitions of this. Everyone has their own analogies. Everyone has their own way to explain this. And to me, the way I think about this, especially its future role, is a sort of like a super smart assistant or like a co-pilot, right? So AI and machine learning are able to learn from data. They learn from experience just like we do, but they're just much better and much faster at it. So for example, in medical school, it would take me like 1 hour to learn a certain topic, and then another hour to actually study at home, and then another hour to really internalize it, and then another hour to learn how to apply this in like a real scenario, right? But AI machine learning models could theoretically just do all of this in like a minute, right? So it's very fast, very effective. It's going to help us make connections faster. So in my view, it's going to be like a co-pilot. So if I have a question, I'm thinking about a topic, I'm going to ask it, I'll ask it, hey, like, I'm thinking about this, and it'll be able to give me a good foundation to build off of in the future. Some basic definitions. AI and machine learning gets thrown around together a lot. It's used interchangeably. I used it interchangeably in the very beginning before I really started to learn about the differences between them. This is very just basic definitions. There's a lot of nuance to this, but just to kind of provide a working definition, as if you will. Generative AI is kind of like what we think about when we think about ChatGPT or Perplexity or DeepSeek, right? These are models that can create new content based on the input that we provided and based on its own learning from the available data out there. Machine learning is a little more focused, you could say. It uses algorithms to learn specific patterns. And then deep learning is another layer of this where it's more focused and more specialized. This is kind of like the broad overview where we talk about all the different models, the strengths and weaknesses of each of these. So LLMs, large language models such as ChatGPT, Cloud, DeepSeek, these are all what we call, like we talked about, generative AI. It's really good at providing summaries of stuff. So for example, if I wanted to learn about diabetes, I could go to ChatGPT and ask, like, give me some information about this. It'll give me a good summary. If I wanted to make a blog post about diabetes, it would give me a good copy to begin with and to build off of. But there are some limitations, right? So the way these models work is that it uses the available data out there, and this data is usually has a certain cutoff. So it'll learn everything before this cutoff, and anything after it, it may not pick up. And as we know, everything, almost every day in technology and medicine, there's something new that comes up. So it may not be the most up to date, but the newer models are getting better at this, and this cutoff point is becoming less and less of a problem. As you probably know, it's also related to hallucinations. This was something that I encountered when I first started using ChatGPT many, many years ago. I'd use it for research, kind of just to play around with it and see what it did. And I vividly remember I was trying to finish a project. I wanted to kind of do it a little quicker. I asked it some certain questions. It gave me a very nice paragraph and it cited some sources. And then when I looked at the sources, it didn't exist. So I'd search up the title that it gave, it didn't exist. And then I asked for like a link to the source. It gave me a working link, but the link was to something completely different, right? And that's because the function of it at that time was to act like a human writer, not a human researcher. So it was just providing like the content that you would expect it, but not necessarily backed up with the right sources. Of course, things are much better now. Like things are getting better. A couple weeks ago, we heard about DeepSeek and its reasoning ability. A couple of days ago, we heard about deep research and like all these different kind of models that are coming out and different kind of features. I've played around with them and it's actually getting much better. So it is getting better. There's still a little bit to go. And then a next level above this. So if we think LLMs are kind of general use, the next level above this will be the traditional machine learning models, right? These can analyze very large data sets, pick up on trends that we may not be able to pick up, and it can be used on general CPUs. But there are some kind of drawbacks to this as well. So one of my first projects in this area was to work on segmentation for a machine learning model, looking at pathology slides. And what I mean by this is that if you're going to train a machine learning model, you have to give it the data that it can use and that is verified as correct, right? So if I wanted to make a machine learning model to identify dogs in a picture, I'd have to get a bunch of pictures. I'd have to circle all the dogs, all the different types of dogs, all the different types of pictures, and then give that data to the model for it so it can learn. There are some drawbacks, like it's not really useful for very complex data sets like videos and speech. And there is this phenomenon where the size of the data set doesn't necessarily come like one-to-one correlate with the performance. And this is something we see in research, right? So there's a lot of groups creating different machine learning models to predict different things in medical research. And these models are very effective in the data set that they train this on, but when they apply it to a larger data set, it becomes a little less efficient. And this is just something that is commonly like we see in the research. And is again being addressed with as things get better. And then finally, deep learning, it's a little more focused and nuanced. It can handle larger data sets, its performance scales with larger data sets, and it's able to handle more complex data. But as you can probably think, as it is able to handle more larger and complex data, it requires a lot more resources and time. So that's the trade-off we have here. So Romulo and I are going to talk about the role of machine learning and AI in terms of medicine and neurosurgery, but we kind of wanted to set the scene per se and talk about it in medicine as a whole first. And we think that there's three big areas where this is going to have a huge impact. So for example, medical imaging, if you can imagine, you know, you have an X-ray, a broken bone will look in a certain way, and then a normal bone will look another way. And this is a very good use case to have something like machine learning, picking up on these patterns and coming up with kind of predictions and coming up with and helping radiologists become more effective and faster, right? Another deeper aspect to this is picking up radiological features that wouldn't necessarily be able to be analyzed by radiologists. So there was a project I worked on at UT Southwestern where we would be able to detect very small radiographical features from early stage pancreatic cancer. And this is something that, you know, pancreatic cancer is something that mostly shows up late stage, and this is another way that we can use AI to detect things earlier. Precision medicine is another very new subfield of medicine, where the idea is to provide tailored, individualized treatments to a patient. So every patient's physiology is different, every patient's body is different, and every patient's disease will be different accordingly. So there is a future where we can use AI models and machine learning models for a cancer patient per se. And so they'll take a sample of their tumor. They'll be able to use these models to assess the genetics. And you can kind of predict if this patient will be a responder or a non-responder to chemotherapy. And this could be a good use case in the sense that if you know a patient has a chemo-resistant cancer, then you can spare them from the toxic effects of a full chemotherapy regimen. And you can kind of tailor the treatments for per patient. And then surgery, we're going to talk a lot about this in the coming slides in the coming time. So I'm just going to save that and not ruin the suspense. So these are the three big areas that we see, but of course, there's little areas outside of this where we can apply AI and machine learning. Drug discovery is one. For example, like we have a lot of data sets, so we can find new molecules that can target certain pathways. We can use it to develop better clinical tools. There's disease characterization, so we can study the molecular and like the protein level of certain diseases and use this data and analyze them to find trends. We can use it for patient education. So one thing I've been noticing recently when I'm chatting physicians in the clinic is that patients will come with a chat GPT response of like all the potential complications from a surgery that they may undergo. And the physician knows that these complications are like 1% of all the cases, and these are not very like in practice and not a really big deal per se, but it's hard to coach the patients about what is a good model to use. And there's some research about this, some research I'm doing at OU as well, that kind of we looked at different models and we kind of figured out which one follows the guidelines the best. And that's a way we can help patients kind of take an autonomy over their own health and give them good quality resources. And then finally, we can use it for medical devices and genetics. I kind of touched on this when I talked about precision medicine, but these are all the different ways that AI can impact healthcare fields directly and all the different areas around healthcare and medicine where it can play a role. So we're going to focus this talk on surgery, and who else? No one else is better to talk about this than our in-house practicing neurosurgeon, Romulo. Like we said, he's a fully trained neurosurgeon from Brazil, and I'm going to hand it off to him, and he's going to talk about the specifics of AI in neurosurgery applications.
Thank you. Thank you, Kishore, for this amazing explanation on AI. So I'm going to talk more about how AI can be applied to the clinical setting, especially in neurosurgery. So we can apply AI in the preoperative setting during surgery and even after surgery. The next slides, I'm going to show some examples on how AI can be applied to these settings, starting with the preoperative setting, especially with surgery planning. Next slide. Okay. So one way we can use AI in the preoperative setting is for tumor mapping and surgical pathway optimization. So how this is done? Some machine learning algorithms can analyze MRI scans and create a 3D map of the brain tumor and the surrounding structures, such as blood vessels, neural tracts. And with this map, we can generate a minimally invasive surgical pathway to the tumor. This way, we can reach the tumor, remove it, while causing the less damage possible to the surrounding structures, enhancing, for example, the safety of the procedure. For the intraoperative support, next slide. We can use AI, for example, for real-time comprehensive surgical support. This can be done by providing, for example, a real-time sub-millimeter accurate navigation around critical structure, which improves safety. It can also offer instant risk assessment and complication prediction based on real-time data. It can also provide a tailored guidance to each patient's unique anatomy and condition, giving more personalized treatment to the patient. And it can also enhance the surgeon capabilities through augmented reality, overlays, and robotics assistance. So in the pictures here on the right, you can see an AI tool helping the surgeon by providing the risk of bleeding if the surgeon does a certain maneuver or a certain movement, so it can aid the surgeon during the procedure. Next slide. And AI can also be support after surgery in the postoperative care. Some AI models can predict complications such as infection, and this can enable the care team to take actions to mitigate or even avoid that complication. It can also help automating follow-ups and triage, which ultimately reduce the clinician workload and cut hospital costs. And it can also generate tailored recovery plans using patient-specific data, which improves adherence and outcomes. Some other ways AI can be used in neurosurgery is through augmented or virtual reality. By simulating surgeries for training purposes, for example, for residents or even more experienced surgeons, and for surgery planning. So the surgeon can do the surgery before the real surgery and be aware of any complication that can appear. And AI can be used with robotic assistance to enhance precision in delicate procedures as well. And what I think is a very interesting use of AI is in brain-computer interfaces to restore motor function in patients, for example, that have paralysis. So talking more about the research me and Kishore are doing related to AI, me at MD Anderson, along with some of the residents, we've been working on this machine learned model for predicting vertebral body compression in patients with spinal metastasis. So patients with cancer, they usually develop spine metastasis, and eventually these vertebrae, they fracture, causing pain and lowering quality of life. And knowing which patients will develop fractures is important, so we can offer the patient maybe ways of mitigating, reducing the risk of fracture, or even treating the fracture before it happens. So this is a very interesting, and it has the potential to help many patients. Kishore, do you want to talk more about your research?
Yeah, sure. A lot of amazing things happening at OU neurosurgery for sure in this space. I've gotten the opportunity to be involved in a lot of cool projects integrating neurosurgery and AI at all different levels. So for example, one of the earliest projects I got involved with was the identifying or like seeing the role of AI in research and education. So we looked at different models to see how effective they were in taking the role of a peer reviewer for scientific literature. And we compared this against an experienced reviewer and then a group of first-year medical students that just took a course on how to be a peer reviewer, right? So we had three different levels, you could say. And we found some really interesting trends. The AI model, because it's new, it interpreted almost everything as novel. So like even just clinically kind of conventional things, it gave it a very high score for novelty. The experienced reviewers score distribution was a little more normally distributed. So they had a little bit of like low scores, medium scores, and then high scores as well. So it was a little more normal. And then the medical students was really interesting is that they didn't want to commit to one side or the other. So the majority of their responses was just straight down the middle. So average. So it was a really interesting trend. No one had ever done this before. So it's really cool to see, some of these applications. We also are looking at its role in simulated case decision making. So a big part of surgical education and residency is like getting prepared for oral boards. And one of them is basically it's a scenario where an experienced surgeon will give you a case, and then you're supposed to talk through the case and explain your decisions to that person. And usually the case involves a complication, right? So you have a procedure, something goes wrong. What do you do next? What is the best next step? And residents, that's a way of learning how to take care of these decisions. And we wanted to see if AI could do better or how it does in just handling non-normal situations, right? Things where complications or things go bad. Interesting results there, but I cannot share that, so just stay tuned. And then the final one, we're working with a group that has developed a deep learning model that I kind of talked about, where they are looking at different surgical videos done by residents and attendings and kind of seeing the differences between this. And they're like looking at very granular details, like they can go down to the level of how much your hand is shaking. Are you using the optimal path from one place to another? Is like the edge of your hand hitting critical structures and you don't even notice it, things like that, where you can kind of give objective feedback. Like a resident can use this, take their video, run it through the model, and get some objective feedback of how they can improve to make their surgeries safer and more effective. And a way of thinking about this is kind of like, I don't know if people have seen the movie Moneyball, where there was a trend from using a stats, like a qualitative approach on how to analyze a baseball player, to a more stats-based objective approach. And this is kind of a similar a similar idea, right? This is kind of neurosurgery's Moneyball moment by using AI and machine learning. So some of the really cool, interesting things that we have going on. It's a broad topic. We try to kind of give everyone a primer and go into details, but I'm sure there's going to be questions. So we're really, really excited to answer any questions and talk about anything you guys want to talk about.
Well, Kishore and Romulo, really appreciate this, fascinating presentation and, just talking about and learning, these details and of course the really cutting edge research that both of you are doing at your institutions. With that being said, we do have a few questions for you about, your work and this topic. So, and this, obviously is perhaps a little bit of a broad question, and everybody likes to make predictions, right? How would you guys say, how do you see AI evolving in neurosurgery over, let's say, the next 5 to 10 years?
Yeah, it's a question on everyone's mind, especially now, with all these emerging technologies and all these new models. And you hear a lot of things. You hear everyone from saying that, okay, AI is going to be useless, it's not going to be really helpful in surgery, to like, oh, it's going to be the next surgeon, like it's going to act like a complete surgeon and have robots doing all your surgeries, right? I think it's going to be somewhere definitely in the middle. Like I was talking about earlier in this presentation, I think it's going to help a surgeon be better and do better. It's not going to replace the surgeon. I really like to think of like the co-pilot model, where it's there to give you, data-based advice on what it knows. But at the end of the day, there are going to be certain situations that this model is not going to have encountered in the past, that the surgeon will have encountered, or the surgeon will have some kind of clinical expertise and clinical context. And then that's the kind of the meeting point, right? So the AI will give the data-based solutions, the surgeon will use their clinical context and experience, and then to make a decision based off that. And I think that's what's going to be the future, is using that as a tool to make better decisions, not necessarily replace the person.
Yeah, I agree with Kishore, and I see AI being increasingly being used in neurosurgery. And as a neurosurgeon, constantly we see situations where we have to deal with a lot of information, with a lot of data from labs, from clinical data, from imaging. So sometimes it's hard to keep track of everything. And I think AI is going to be very helpful in this sense of, managing and analyzing huge amounts of data and giving you like a summary, and which things you should pay more attention to and which not. So I think AI is going to be more into our lives, and it has to be something that enhances our capabilities, but not substitutes, or it can substitute some things but not everything.
I see. I'm the only one with my hand up, so I'll just jump in. First and foremost, thank you, everybody. Thank you both for the presentation. It's great to hear from you both, and the things you got going on. Being actively engaged in the field. I know you gave some specific capacities on how AI is being utilized in research, but I guess more holistically, what do you see as the role of AI in research?
Because I'm on my research year, I've experimented with using these technologies in every way possible to make my life better and easier and faster, right? Because that's the name of the game, especially for me at my stage. And And I think it comes back to the same thing. It's not very good at like writing a paper. It's not very good at making connections. It's not very good at writing a discussion for like a manuscript. You know, those are things that require like a context and a kind of experience and an ability to make the connections that, you know, an AI model or like a ChatGPT or Perplexity cannot do. But it's very good at giving me like a starting point, right? So if I don't know something about like a certain condition or like how it's usually treated or what the conventional treatment methods are, it gives me a very good starting point to investigate further. Perplexity, especially because it gives you cited sources, all these kind of things, so I can trust it a little bit more. And it's helped sometimes with like identifying some trends in the data, right? Because it's something that it's kind of purpose built for, like identifying patterns. But again, like a lot of my attendings will be like, oh, you're just going to use AI to write the paper. And it's like, no, it doesn't, you know, it doesn't really work that way because there's still a lot more human input to this process, especially research when you're generating new evidence and generating new data, right? Like AI is like basing it off the previous data that's been established in the world, and you're trying to put new data into the world. So there's a little bit of there's a little bit of a disconnect there, which it cannot do.
Yeah, for me, I've been using AI, especially to have some extra ideas, new perspectives, new hypotheses, and then you can also use AI in research to review your paper, to review for grammatics or something like that. And as Kishore said, I don't think it's going to be like substituting the work because there's much we do that the AI doesn't do or do it badly. So it's a very great tool. You just have to know how to use it, and it can enhance your performance for sure.
Awesome. You know, with all this being said, and you know, seeing all the usefulness of AI and neurosurgery, and you know, the question then comes up, you know, and this is something that we, you know, at Lilia AI and with everything we're doing, you know, hold of as you know the utmost priority is, you know, to make sure that every piece of innovation that we are thinking of that you know we want to build and implement is going to help patients and you know ethically patient ethics you know come first no matter what. And with that being said, you know, do you guys have any thoughts on any ethical concerns about how AI impacts patient care related to neurosurgery, especially, for example, in decision making?
Yeah, of course, this is a very interesting topic. So the AI brings with it some concerns. For example, how did the AI came to that conclusion? So how was the process thinking of the AI that brought that result to you? So some models, you cannot have access to this. You don't know how the AI reached that conclusion. So, which is called like the black box thinking process. So this is a problem because you don't know if that's a valid way of thinking. And also AI uses available data that's already there, which can be biased. For example, many of the papers that are published, they have this bias of only positive results are published. So this can bias the results of the AI. Also, some populations are underrepresented in the literature, so this can be also biasing the results of AI. So these are some concerns we have regarding ethics and the use of AI.
Yeah, I think that's a very important point, especially the black box reasoning, as it's called. It's not every model discloses the way it interprets and comes to its conclusions. So especially if you're in a case, like for example, like if you're in a surgery and you're trying to ask it for kind of intraoperative advice, then you're gonna have to take that with a little bit of skepticism and with a grain of salt, because you don't know where that information is coming from. And that's kind of a scenario which you would prioritize your own clinical judgment and your experience. And then, like Romulo pointed out, like the discrepancies in the available data, like we see that in neurosurgery research. Like there's a whole subsection on global neurosurgery that's kind of trying to bring out all of the data and all the outcomes of patients in low-income countries versus high-income countries, right? So when you're trying to make a model and you're trying to ask it a question, all these things come into play, because if you're going to ask what is the complication rate of a certain procedure, it'll probably use data from high-income countries that have been positive, right? And you don't really get the full picture. So these are the kind of things that that are kind of ethical questions. But these are also general use AIs. So maybe like things like Lilia is doing is going to be very specific targeted tasks. And I'm sure the quality of data is going to be very high. And that's kind of how the models work, right? Like good data in, good data out. So I'm in a very, for very specific use cases, you can kind of control these biases a little better. But if you're trying to make raw judgments, then it might be a little more complicated.
Yeah, I guess so. Since I have my hand up, I can go next. I want to say thank you guys for being here today. The presentation was very informative, and personally, as someone who's currently in training, I'm very excited about the applications you mentioned in terms of, training procedures, doing things with accuracy and improving patient outcomes. I guess my question is kind of related to something that you guys just touched on. So kind of just building off that, I recently read a couple of studies and articles about how AI can AI in healthcare can perpetuate certain biases, right? Especially when it comes to like Latino or Black populations, because these models have been historically trained on biased data. So how I know you said it is a concern that it's a concern that everyone has to deal with, but since both of you guys are involved in building machine learning models, how do you guys ensure that the AI models you're building are free of bias and reliable?
This is a very difficult question. It's not, I mean, like even with anything, I think it's very impossible to get something bias free, right? It's just human. Like if you have anything involving a human is going to involve a little bit of bias. That's just kind of, my view on like just how the world works. But like I think it goes back to, again, like identifying the best case or the best tool for the best situation. So if I'm trying to get a general idea or a general recommendation for something, I'm not just going to take AI's like word for it, right? I'd have to look a little bit deeper into it, use that as a starting point, and investigate further, research further, all that kind of stuff. But if you use it for very specific cases, then I think you can control for that by making sure the data that you build is high quality. I don't, yeah, I think that's the only kind of way to do it. It's kind of very hard to get something completely bias free. What do you think, Romulo?
Yeah, I agree. And as you said before, much of the outcomes, it depends on the response or the answer that the AI gives you. It depends on the data it was trained on. So I think one of the most important things for a reliable, free of bias model is to feed the model with good data, which means data from a diverse population, for example. Yeah, and also it has to be constantly checked to see if it's still, reliable, and if not, it has to be retrained. So this constant human check of the AI is important as well.
Hey guys, so you both have said a couple times that AI is a tool, right? And that very well may be the status of it today, but predicting as far out as either of you are comfortable. I mean, do you ever see AI replacing certain aspects of neurosurgical decision making. I mean, I know that's a big Hollywood portrayal that you see in a lot of sci-fi movies, right? And that I think that's something a lot of the general public, maybe not necessarily the medical community, but something a lot of the general public thinks is that one day we won't even need surgeons, that AI and robots are going to be doing everything. So I'd love to get your guys' thoughts on whether or not that's even an accurate prediction at this point in time.
I'll tell you probably a good example of the most like technologically involved like care kind of scenario. We had this presenter from Mayo who came to our grand rounds, and he was talking about the applications of AI in neurosurgery, and he was kind of giving the most right side view of the use of AI and like the most involvement of it, right? So there is like a future in his mind where a patient can come and they need some kind of prosthetic, so they'll use the scans to build 3D, like a 3D model of the patient's spine per se, build custom prosthetics for this patient, and then use the scans to help the surgeon use VR and AR to train for this surgery. And then we'll then like be able to have a custom prosthetic for a custom patient. And then there was another part of this where he was talking about digital twins, right? So like their future, they think, where like a clinician's sort of decision making can be modeled, like an individualized pattern can be remodeled, and they're proposing to use it for like consults. So like if you show up in the ED, Dr. Romulo can give you his view of what needs to be done next, even though he doesn't need to be there in person. It could be like a digital twin of him giving you this advice, and there can be like 10 of his twins running around the entire hospital giving advice to everyone, right? So that is kind of like that's something I heard. Whether it's going to happen or not, there's a lot of things that go into that, but we can project this and make it completely automated system where you just show up in a hospital and a bunch of robots take you in, put you on the operating table to do surgery, and then like you're gone. It's fun to think about. I think it's really important to have these kind of exercises, because then you can think about the most crazy situation and then kind of think about like the ethics behind it, build safeguards, and build a better way.
Yeah, that's true. And also, I believe that it would say you substitute many of the things we do, especially those things that are associated with data, for example. And it will be very helpful, like reducing the time we spend on certain things, for example, charting. I think these tools can help us. And also the patients. So it's a very nice thing for the patient to have, for example, an AI-powered virtual assistant that can, he can reach out to ask questions about the procedure and at any time of the day. So I think it engages the patient with his or her own treatment. So I believe we'll substitute many of the things we do, but not all of them. And we have to see this as a tool, not as something that will do the work for us.
Yeah, just to follow up on that. So, speaking of doctor-patient relationship, usually like when I went to clinics recently to do my rotations, I've seen doctors use AI scribes, and they'll be present with us in the room, and that does give more time for direct, doctor-patient interaction, which is a positive thing. But the flip side of that is I remember, I think, reading a study in Nature Medicine. It was late 2024. And basically, what the researchers did is they recruited a couple of patients and they gave them advice. And half of them, they told them the advice came from an AI bot. It's like a medical AI bot, and the other half from an actual physician. And the patients were a lot more likely to trust the advice from the actual physician. And a lot of patients have raised concerns about the privacy, possibility of misdiagnosis. So you do see this, group of people But then at the same time, you do see that other group of people that trust AI that comes to the doctor with, oh, look, I read this. So, how do you think, like, where would the sweet spot be? How should the doctor-patient relationship be impacted, or how's it going to look like?
Yeah, this is an important question, and I think soon will be, the surgeon or the team has to, disclose the use of AI, and the patient has to have the right of choosing or either to have AI used in his care or not. But AI can be a positive thing because as it takes into account the patient's labs, the clinical exams, um, the lab findings, imaging findings, it can give the patient a more personalized treatment. And also the physician may have more time to spend with the patient. But on the other side, if you rely too much on AI, it can give you more AI-based care and not much of a patient-centered care, which can be a problem, especially in patients with life-changing conditions, such as patients suffering from neurosurgical conditions. It's a matter of um, debate. It's hard to talk.
I feel like a common trend we're seeing is always like a middle ground, trying to use it as a tool to help versus replace. Um, I I would I haven't obviously taken care of patients and stuff like that, but the way I would think about it being in training would be to use it to just enhance capabilities. Because even during my rotations, my most favorite part of everything was being in the room with the patient, talking to them, trying to make a connection, right? And that to me made all like the stress and the fatigue of going on rotations like all worth it, because just being in that room and talking to them and making a connection and try to like help them through something was helpful for me. But there would have been times where I would have like having an AI assistant where like I could make sure what I'm saying and talking to a patient is accurate would have been helpful, right? To have like a pocket assistant that's like, hey, this patient's asking me about this surgery. What is the easy way to explain to them? What are the complications to look out for? Like, what should I do next, right? So I I think it's going to be difficult at first, but I think, that's why like having physicians and people in the medical profession involved in the creation and the use of like AI technology and also like around the implementation and policies around it is going to be really important. So then we can set kind of boundaries and kind of define the role and make sure that it has limited, like a most appropriate scope, and build it up from there and protect the patient physician relationship.
I guess just to piggyback on that question. So one of the things that always comes to my mind when I read things about the capabilities of these models and, all the medical advice that people are getting is the sense of distrust that patients might develop with physicians. For example, not too long ago, I've seen a patient come to the doctor and say, oh, you told me that this would not happen, but I read that it does happen, and it did happen to me. So I've seen a segment of patients that are, when they see that the AI knows more, which, because it's a language model, because it has an access to a whole lot of databases, sometimes the AI would know the answer as opposed to the physician knowing the answer at that moment. So is there a fear about a potential sense of distrust developing in the doctor-patient relationship?
I think a good example. So one of the projects that I was working on was to address that specific point, right? So we had a list of neurosurgical conditions in which we had Congress of Neurosurgical Surgeons, like guidelines. So like this is established guidelines by people in the field that the consensus is this is the best way to treat this kind of situation. You should do this, you should not do this, right? And then we asked different AI models questions based on these guidelines, and we found which one is most congruent to the established guidelines. And we tested a couple different models. One of them was ChatGPT, and we found that it was not very effective because it didn't recognize or didn't see these guidelines for the majority of the time. And it doesn't tell you what it cites, right? It doesn't tell you where it's getting this information from. And another thing that it generally tends to do is called hedging. So it'll give you like every possible situation or scenario for whatever your question is, because it doesn't want to give you a definitive answer, right? Because it's kind of hedging its response. But on the flip side, we saw another model called open evidence, which was an example of a physician-driven, kind of like a healthcare-driven application, a healthcare, like a AI application where multiple institutions were involved in the creation of this AI model. And this entire purpose, the model's entire purpose is to give evidence-based responses to medical questions. And that has been, when we compared the different models, that was the one that consistently cited the guidelines. And when we're talking about this with the attendings, it's like, okay, like now I have something I can tell patients. Like if they want to learn more about this, they should use this and not ChatGPT, right? So that could be a way to better augment that relationship. So like, yes, patients would want to know more information. They want to go and take care of their own health, but physicians, you know, by playing a role in the development of these technologies, we can provide them with the answers that they're looking for and making sure that they're accurate answers.
That was a great answer.
Well, you know, if we don't have any other questions, I mean, that was you know, great presentation. You know, really appreciate these very thoughtful and, you know, detailed and helpful responses to, you know, these questions. I mean, I've certainly learned a lot. Found this all very informative. I'm sure that, you know, our viewers will as well. And as mentioned, you know, we're really honored, you know, that you guys, you know, joined, and you know, we're our first ever Lilia AI webinar guests, and you know, also share the same mission that we do at Lilia AI, which is again to build the not just the most innovative, but the most useful technologies in healthcare to improve patient care. And you know, it's a team effort, and the work that you both are doing, you know, at your respective academic neurosurgery departments, no doubt will lead to, you know, further innovation down the line. And we look forward to, you know, reading more as, you know, you guys continue to publish. And you know, thank you again, and be on the lookout for Lilia AI webinar number 2.
Thank you, Ali.
Thank you for having us. It's always been a pleasure.
Thanks, everybody.
Thank you.